Hi, my name is Jennifer Smith from the Coping with Depression blog at healthyplace.com. And today I'd like to talk about how we can reduce the stigma that surrounds mental illness. First of all, we know that we often hear people use improper terminology in regards to mental health issues. One term that we often hear is that people have committed suicide. What we should hear instead is that people have died by suicide. When people use the phrase committed suicide, that makes it sound as if the person who has passed away has committed some kind of crime, when what people should realize is that people who die by suicide are people who have struggled mentally, who have gotten to a place of deep pain, and they don't do these things lightly, and it just further stigmatizes mental illness when you make it sound like it's some kind of crime. Another term we may hear is if someone has a mental illness, someone may flippantly call them crazy. Instead, they should use proper terms like that person battles anxiety or depression, or that person battles bipolar disorder. We need to take away negative connotations. We need to speak about mental illnesses in the same way we would speak about physical illnesses. Another term we may hear is, oh, that person belongs in the Looney Men. And that's very insulting to those of us who have been in a mental health facility for the treatment that we needed. And it needs to be something that people talk about and don't talk about it in such a negative way. And so when you hear people use those terms, you can gently correct them and you can educate them. Another way in which we can help reduce stigma is to talk about the stereotypes that we often see on television and movies. We need to point out when mental illness is portrayed in a wrong way. It's often portrayed negatively. It's often portrayed in characters that act in violent ways. And that's not the case for most people with mental illness. And that's another stigma that needs to be eradicated. And so that's a goal that we need to work towards. Finally, we need to direct people to reputable sites about mental illness, such as healthyplace.com, and also direct them to local organizations that work for mental health education, and show them that this is something that people struggle with, and it's not something that needs to be kept quiet. It's not something that needs to be made light of, and it's certainly not something that needs to be stigmatized nor ridiculed. So if we follow these things, my hope is that during this month of Mental Health Awareness Month, and then throughout the rest of this year and the years to come, we will begin to see the end of stigma that surrounds mental illness. Again, this is Jennifer Smith from the Coping with Depression blog at healthyplace.com.